Maria Dolma Santos, and today we will be talking about the utilization of dexkitoprofen in maintaining an NSAID background in acute pain management. For my disclosure, most post-operative pain management regimens utilize multimodal analgesia. Since surgical trauma stimulates the inflammatory response, non-steroidal anti-inflammatory drugs are considered a core component of multimodal analgesia due to their anti-inflammatory and analgesic properties. NSAIDs work against COX-2, which is overexpressed during the peripheral inflammatory state and is the therapeutic target to modulate inflammation. In addition to this peripheral action, inhibition of COX-1 is thought to reduce the risk of pain chronification through the inhibition of spinal glial cells that play a role in spinal sensitization. Hence, dexkitoprofen may be considered a complete anti-inflammatory medication with peripheral action mainly through COX-2 inhibition and central action at spinal cord and glial cells through COX-1 inhibition. The concept of preventive analgesia advocates analgesic treatment continuity for as long as there is noxious stimulation. Preventive analgesia provides pain control during the pre-incisional period, which we refer to as preemptive analgesia, during the intraoperative period, and all the way to the postoperative period. When an NSAID is found to be well tolerated and effective in a patient, there should be no need to alter that NSAID background for the entirety of the acute pain management journey. Dexkitoprofen has been found to be well tolerated in this context, and the same was noted to be true with the use of a fixed dose combination of dexkitoprofen and tramadol in Asian patients. It is important to note that the acute postoperative pain journey will usually last beyond discharge. Hence, acute pain should be addressed consistently and not overlooked during this phase. Dexkitoprofen offers the advantage of having both parenteral and oral formulations. The intravenous formulation may be used for the immediate postoperative period when patients are on fasting. The intramuscular formulation is an alternative route when there is no intravascular access. The oral tablet may be administered either as a fixed dose combination with tramadol or as monotherapy for the later postoperative period and throughout recovery. While the route of administration may change throughout the pain management period, the active treatment is maintained with dexkitoprofen. Among Asian patients, pain tends to be underreported and undertreated. Barriers to effective acute pain management include ethnocultural factors such as stoicism, which may cause patients to be reluctant to ask for pain relief. Lack of sufficient patient education about the importance of timely postoperative pain management and preference for conservative pain management approaches may also contribute to the undertreatment of pain in Asian patients. This review on screens investigates the use of multimodal analgesia for postoperative pain management in Asia with a focus on clinicians' experience with dexkitoprofen as an NSAID therapy throughout the postoperative period and, when necessary, the use of a fixed dose combination with tramadol, which is a centrally acting synthetic opioid analgesic. The article proposes the following postoperative pain management transition utilizing a dexkitoprofen background. The table on the slide shows the degree of pain severity across the intraoperative, postoperative, and discharge phases. For each of these phases, the analgesic technique or regimen is indicated. So for analgesia, during the intraoperative phase, we have the option of using regional analgesia or anesthesia with opioid-sparing techniques. During the immediate postoperative period, there is an optimal window for early and aggressive pain management. And this is where we transition to oral multimodal opioid-sparing analgesia as soon as possible. So this is usually within the first 24 hours after surgery, and route will usually be still intravenous, and guidelines still dictate the use of strong and or weak opioids plus an NSAID. For the latter, postoperative period, that is postoperative day 1 to 5, the route may be shifted to oral depending on the type of surgery, but guidelines still recommend a strong or weak opioid plus an NSAID. During discharge and beyond, pain is expected to recede in intensity and may be mild to moderate. So this is usually at post-op day 6 to 10, okay, or more. And route with the patient being discharged will most probably be by mouth. So the guidelines still recommend the use of an NSAID plus or minus paracetamol. For our therapeutic options or drug options, for immediate postoperative days, immediate postoperative phase rather, that is within the first 24 hours, we have the following options, either strong or weak opioid. If available in your institution, you can have hydromorphone, oxycodone, morphine, and a weak opioid, tramadol. NSAID options include dexkitoprofen IV, ketorolac or the traditional NSAIDs, ketorolac, diclofenac, and the coxib, parecoxib. Okay. For day 1, post-op day 1 to 5, which falls under the later postoperative phase, there is still a recommendation of strong or weak opioids. And this includes the same options, tramadol as the weak opioid, and stronger opioids, oxycodone, morphine, and maybe a fixed combination preparation of tramadol and paracetamol. The NSAID as a base or a background analgesic is still recommended during this period. And you have options between the traditional NSAIDs, the newer NSAIDs, and of course, the coxibs. At this point, you can also transition to the fixed dose combination of tramadol and dexkitoprofen, especially if you were able to start off with parenteral tramadol and parenteral dexkitoprofen in the earlier phase, which makes the step down to the oral fixed dose combination much more convenient. Now for discharge and rehabilitation, that is maybe 5 days, post-op day 5 and beyond, oral preparations are recommended, which still includes an NSAID plus or minus the paracetamol. Supportive measures for functional recovery are also indicated in the last row, such as early mobilization, early oral intake of fluids and solids with regular pain assessment. Additional expert opinion on dexkitoprofen fixed dose combination or monotherapy includes the following. When transitioning out of regional anesthesia, pain will most likely still be in the acute phase. During this period, the use of an NSAID as part of a fixed dose combination is an optimal choice for a step-down analgesic. Maintaining an NSAID background as the chief component of the multimodal analgesia regimen is pertinent, even essential, in the face of the noxious inflammatory cascade. If an NSAID is found to be well tolerated and effective in a patient, there should be no need to alter that NSAID for the entirety of the postoperative pain management journey. Again, dexkitoprofen has the advantage of being the NSAID of choice due to its documented tolerability and its availability in a variety of formulations that can sustain pain control from the immediate postoperative period through recovery, discharge, and rehabilitation. Thank you for your kind attention.
As the COVID-19 pandemic continues to affect our daily lives, we'd like to take a moment to focus on our patients living with pain. Even at the best of times, inadequate pain relief can negatively impact many areas of life. During the COVID-19 pandemic, these challenges may be exacerbated. Despite having pain, patients may avoid going to the clinic or hospital due to the fear of being exposed to COVID-19. Healthcare resources and staff are often redeployed to infection control, and pain clinics may close as a result. So patients with chronic pain may find their pain is harder to manage during the pandemic, and it may even get worse. Patients with acute pain may leave it untreated and keep on living with it, but untreated acute pain can ultimately progress to chronic pain. While the challenges of COVID-19 have been tough, they have also created stronger, inspiring partnerships across hospitals and healthcare teams. All of us here at MENARINI Asia Pacific want to acknowledge and thank all of you in the healthcare world who are so strongly committed to standing on the front line during this pandemic. As part of the pain community, our vision is to work to alleviate pain and invigorate lives. Our pain portfolio features a diverse spectrum of pain management solutions, from acute to chronic to cancer pain, allowing us to help you alleviate pain for patients from all different walks of life. We are also working hard to support your professional needs as you continue to battle COVID-19 by bringing services to you, such as continuous medical education content via regional webinars and local sharing of best practices in telehealth. The well-being of patients living with pain is a top priority for MENARINI in these challenging times, and we are here for you. Contact your local MENARINI representative for information on how we can work together to improve the lives of your patients suffering from pain.